there, my name's Charlie. I'm the lead neurology registrar on the Optimise Interview course, and I've been asked today to give you a short video with my 3 top tips about how to nail your neurology presentation in your upcoming registrar interviews. My first point would be to, as much as you can, talk like a neurologist would. So I'd really think about a neurologist that you like, that in some ways inspires you, in other ways you just think does the job how you would want to do it. And I'd ask them how they would present the case you're going to present. I'd present the case to them as many times as you can, and in that I would listen out for the words they use and the words they don't use, the things that they emphasize and the sort of the things that they dismiss very quickly. And I know it's very difficult as you sort of go through your training up from sort of junior SHR up to sort of more senior IMT. You're sometimes mixing with different specialties, and sometimes you're seeing other specialties how they present, especially sort of grand round type things. But if you can, go to a few neurology grand rounds or watch them. There are loads available on YouTube and via the ABN, and just see the words that neurologists use and the words that they tend to avoid, and I'd sort of start there. The second tip I would give is that I'd choose a case that you know. So lots of people get very anxious about their case presentation and their case selection, whether or not they're choosing a case that's too easy or a case that's too difficult and too esoteric. My advice would be, it really doesn't matter what kind of case you choose, as long as you understand the case, as long as you were present for parts of the case, and if not all of the case, and a case that when you're thinking about, it's very obvious to the examiner, as you're talking about it, that you're thinking about the patient themselves, and that you're sort of working your way through, as you talk to them, a story that you have seen develop rather than a story that you've been told. I do think it becomes obvious as you talk about it, how passionately you're talking about it, how you're talking about some of the investigations, whether or not you were really there, or whether you just got put past this case when you asked if anyone had a good case for your interview. They know you're not a registrar yet, certainly not a neurology registrar yet, or you wouldn't be there. So they don't expect you to have picked up the case in A&E, taken them to your clinic, taken them through to your biopsy list and presented the diagnosis. They don't expect that at all, but they do expect that you've been around when the decision making was happening, or at least been sort of involved in thorough discussions after the decision making has happened, and sort of accepted that as well. And my third point is incredibly obvious, but I would just practice. I would practice on your own. I would practice videoing yourself, just like I am videoing myself right now. It's uncomfortable at first, it's difficult, but you have to get good at looking at the camera, not looking at the screen, and you'll see how obvious that is. You have to get used to just talking into the abyss, because while you're presenting your case, they are not talking to you at that time. They'll wait till your time allotment is up. And I would also practice, obviously, off camera, to as many neurologists as you can. Obviously, when you come on the course, we can do as much practice as we can. But I would speak to the neurologists that were involved in the case, in case there's anything you've actually missed that was useful. I would, again, as come back to my first point, I would choose a neurologist that you like, and this was a big part of my preparation. So I found a neurologist I really liked and I really wanted to be like, and I went up to him and I said that, and I said, this is the case I would present, how would you do it? And he told me how he would do it, and then I sort of incorporated as much of that into my presentation as I could. But sort of, as you'll see from these 3 points, is the main take home is that this is a station you can own, and that you should own, because they've told you exactly what you're going to get during the station. And my first tip would be choose a very clear structure. This sounds very obvious, but it's very frustrating when a very good candidate with an excellent CV is having to think their way through their CV as they're telling it to you, and sometimes getting distracted or looping back, inserting something in slightly the wrong place. So choose a clear structure you're comfortable with. A lot of people use the sort of CAMP, clinical, academic, management, personal structure, which I think works really well, and stick to it. And that just helps the interviewer focus on what you're saying rather than thinking, where are they going to go next? I always start with my name and the current job I'm doing, and then I go into whatever structure I'm going to use. But it just gives them something to build off, and I think it sort of gives you the best chance to really shine. The second tip I give everyone is to remember that you are applying for a job here that you think you should be able to do. You're not applying for a job that's aspirational, that's well beyond reach, and you don't really need to talk anymore like an SHO. You need to talk like a registrar. And by that, I mean you need to say that you took jobs on and that you got something out of them. And you need to drop language that implies you were lucky to do jobs, or you were fortunate, you're at the right place at the right time. And I know it's very easy to say that. We all have imposter syndrome sometimes, but you have to sort of change your language slightly to be, I did a neurology job and this is what I got out of it. Or I've done a lot of stroke cover and this means I'm very comfortable doing this. And I think that that's the sort of language they want to see. And it also just means that you come across like you're ready to go when you start in February or you start in August. And you're not going to be overwhelmed by it all. And my third point, which is obvious again, is timing. Be really clear that you are not going to be given any more than 2 minutes to present your CV. They will have a timer. They will stop you if you go on too long. They may let you expand on things afterwards and follow-up questions. Oh, I think we cut you off a bit there. What else would you have told us about? But you have to be ready to go, like clockwork, 2 minutes, learn it like a script. Anticipate they'll ask you questions afterwards, but don't, think you can just go on and on, because they will cut you off halfway through your academic achievements and you won't get to tell them that you were the senior registrar or the lead SHO or anything about that. You won't get them to tell them the nice sort of anecdotal personal story you wanted to go in with. So 2 minutes is your absolute target, and practice to get there.